Привіт, мене звати Erika Valek, and today I will be presenting on the developmental impact of trauma. Before I begin, I wanted to give you an overview of what to expect during this presentation. First, I will provide definitions of trauma and complex trauma, also referred to as CT. Second, I will briefly discuss the impact of trauma on the brain, as well as the impact that trauma has on different developmental stages. Third, I will share the remarkable nature of human resilience described by Blonstein and Kinnenberg and the factors that promote resilience. And finally, I will describe a specific trauma intervention. There are several definitions for trauma. First, Dictionary.com defines trauma as an experience that produces psychological injury or pain. The Center for Nonviolence and Social Justice defines trauma as experiences or situations that are emotionally painful and distressing, can overwhelm people's ability to cope, as well as leaving individuals feeling powerless. The American Psychological Association defines trauma as an emotional response to a terrible event like an accident, rape, or natural disasters that can result in shock, denial, unpredictable emotions, flashbacks, strained relationships, and even physical symptoms such as headaches or nausea. There are different responses to trauma. Some individuals can experience immediate and acute negative effects. Others may not show signs of stress until sometime after the event. And yet a few individuals may never show ill effects from this traumatic event. A second type of trauma is known as complex trauma, or CT. The diagram on the left demonstrates Lawson and Quinn's definition of complex trauma, which results from exposure to severe stressors such as emotional abuse, physical abuse, sexual abuse, neglect, and or witnessing family violence. These stressors can begin in childhood or adolescency. Complex trauma occurs repeatedly over time and within the caregiving system or by other adults who typically are expected to be the source of security, protection, and stability for the child. CT results in difficulties relating to self-regulation or an inability to regulate emotions, relationships, for example, lack of attachment and secure base that can result in mistrust, psychological disorders such as depression, anxiety, post-traumatic stress disorder, PTSD, dissociation, and or eating disorders. CT also results in addictions to alcohol, drugs, or pornography. Self-injury or self-harm behaviors like cutting, burning, or punching may also be seen. Identity problems that may include disruption of sense of self, such as shame, guilt, self-hatred, or sense of betrayal. And finally, cognitive distortions, believing that the world is unsafe and chaotic. To better understand the impact that trauma has on the brain, first, it is important to highlight two key terms. Neuroplasticity refers to the brain's ability to adapt, develop, and change in response to experiences, especially repetitive and pattern experiences. The second term, known as use-dependent, means that the more synaptic connections that are activated and utilized, the more the brain is able to develop and modify efficiently, providing an organizing framework for an infant and child. With positive experiences, the brain develops healthy and flexible. However, when there is disruption of normal development in the case of complex trauma, the brain develops deficits emotionally, behaviorally, and cognitively. Intrapersonal deficits include a lack of sense of self and self-development. Interpersonal deficits consist of inability to form or engage in relationships with others. Regulatory deficits result in failure to recognize and modulate emotional and physiological experiences. And neurocognitive deficits include not being capable to engage in executive functioning and other cognitive abilities, such as memory, motor skills, attention, and perception. Research shows that trauma has devastating impact on different developmental stages. We will discuss the effects of trauma in the following: early childhood, beginning from infancy through preschool years or around 6 years old; middle childhood, elementary school years from 6 to around 12 years old; adolescence, ages 12 to around 20 years old; and young adults, ages 20 to 40. During early childhood, the child is supposed to learn that he exists, how to connect with others, learn to build affect tolerance and regulation, explore the world, and develop basic sense of agency. However, when a child experiences complex trauma and receives unpredictable, inconsistent, or even inadequate care, facial expressions, verbal cues, actions, or soothing and regulation, the child is left with the following: no frame to interpret communication, which results in communicating too strongly or not at all. And for infants, it can range from frequent crying and fussiness to no response. The child who experiences stressful environment experiences less control and less understanding of self in the world, resulting in a sense of helplessness or hopelessness. Finally, a child can also experience loss of structure that can develop in rigid control, such as bossiness, lying, or manipulation, as well as being infused with danger. To give you a better understanding of how children in early childhood development stage respond to social interaction, facial expression, and soothing, I want to share this short video, and you see the link above. In this video, you will see the still face experiment where a mother plays, engages, and interacts with her baby as a caregiver should. However, after a few seconds, the mother stops playing, stops engaging, and responding to the baby. Let's see how this baby responds. During the middle childhood stages, ages 6 to around 12 years old, children who have experienced trauma and who have had absent caregivers or who have not had successful interaction with caregivers have struggles developing relationship with other children, adults, or teachers, difficulties developing a sense of self, and therefore can begin feeling and experiencing self-blame, inadequacy, helplessness, and hopelessness. In addition, children may replicate their caregiver's relationship and attachment style, resulting in difficulties developing trust in others. This can lead to beliefs that others are dangerous, will reject them, or even abandon them. Age-appropriate skills like regulating emotions and behaviors are not developed, and often can produce behaviors such as bullying, hyperactivity, withdrawing, or dissociation. These struggles can also cause a child to shut down, detach, or freeze as a way to cope with overwhelming emotions and/or situations. Trauma also impacts adolescents' development in 4 main areas: physical, social, emotional, and cognitively. Physically, adolescents are experiencing puberty, and as a result of early traumatic experiences, are more likely to be self-conscious and have negative self-identity. Socially, there's a need to belong and fit in with peer groups, and those with a traumatic childhood are at a higher risk of increased danger behaviors, including alcohol and substance use, self-harm, and poor choices about sex and relationships. Emotionally, adolescents may become disconnected, experiencing depersonalization, derealization, or rely on over-control and perfectionism to cope with their emotions. Blossting and Kunnenberg also describes cognitively the brain's function are just developing, and adolescents who have experienced trauma are unable to prioritize issues, sort through problems, or set goals for the future. Therefore, adolescents may encounter splinter aspects of self that are not integrated into a coherent whole. During young adulthood, those who have experienced trauma have a lack of integration across time, experience, and context. They may also have an increasingly splinter and fragmented sense of self and identity. Negative self-concept includes feelings of blame, guilt, shame, damage, and powerlessness that can continue the challenge of emotional regulation. Early childhood experiences result in a lack of healthy, mature relationships and instead can lead to either becoming overdependent and needy or keeping others at arm's length away, only having superficial relationships without meaningful connections. Finally, young adults with traumatic childhoods have deficits in executive functioning, including problems with memory, problem solving, decision making, and anticipation, which Ellen will further discuss during her presentation. Blossing and Kunnenberg describe the remarkable nature of a human resilience as a concept that is intertwined with stress and trauma. Resilience does not exist without the experience of stress and trauma. Resilience is defined by the American Psychological Association as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. It means bouncing back from difficult experiences. Resilience can be developed. It is not a trait people have or not have. They are behaviors, thoughts, and actions that can be learned over time. There are two different types of categories of resilience. First, there's individual and child factors that include models of self, meaning self-efficacy and independence, and models of others, social orientations and ability to build healthy relationships. The second category is systemic and contextual factors. These factors involve family relationships, which according to Blossting and Kunnenberg are the most consistent predictor of resilience, is a safe nurture bond with a single person. This relationship can be an adult, a teacher, a coach, a counselor, and or a pastor. Peer group and peer relationships are important factors. Research shows that having at least one close friend over time predicts resilience. Another important resilience factor involves school experience, such as a positive child-teacher relationship, awareness of child's strengths, feedback, praise, as well as academic and behavioral standards. Finally, community support such as neighborhoods or connection to a larger community is a factor that can predict resilience. As professional helpers, it is essential that we begin to aid individuals who have experienced complex trauma to learn how to become resilient. One trauma intervention that assists in developing resilience is known as awareness of connection to the universe, or also called the grounding technique. The purpose of this technique, according to Heidi Hansen, is to transform the state of the nervous system from activation back to a calm, alert state quickly and significantly. Elizabeth Benningham highlights the importance of utilizing grounding on clients who may be experiencing flashbacks, dissociation, intense depersonalization, or derealization. The goal of this technique is to help connect the patient or the client to the present, help connect the client more deeply with their body, and help connect with their five senses in order to return to a safe and calm state. Before using this technique with a client in distress, you first need to remind the client of who you are and that even though they may feel frightened, they are in a safe place. Remind the client of their name and have them identify things they see and hear while keeping them taking deep breaths. To use the grounding technique with a client or individual, there are several different objects needed to use for support. These include a chair, a couch, the floor, or even a beanbag. Additional materials to utilize to ground or de-escalate and calm an individual may include a pillow or stuffed item such as a teddy bear or a stuffed animal, a stress ball or silly putty, different weighted items such as ankle weights, wrist weights, and weighted blankets, as well as different textured items like velvet cloth, sandpaper, bubble paper, or feathers. To practice grounding technique, we will first begin by comfortably sitting on your seat where you can relax and focus for a few minutes. Take a few deep breaths. First, we will begin by focusing your attention on the sensations in your feet resting on the floor. Keep your attention on that area for a few minutes. Allow yourself to become more relaxed, more aware of your feet resting on the floor, more curious about what is happening with your body, and continue taking deep breaths in and out. What do you notice? Is there pressure on any part of your feet? Do you notice any differences in temperature? Describe in your mind what sensations and feelings are occurring on the bottom of your feet, on the inside of your feet, and on the surface of your feet. Feel what it feels to be supported by the floor. Feel how solid the floor is. Remind yourself that the floor supports you. Second, let's focus your attention on the bottom and thighs touching the chair. Keep your attention on that area for a few minutes. Allow yourself to become relaxed, more aware of your bottom and your thighs resting on the chair. Consider how the chair accepts you totally. What is happening with your body? And continue taking deep breaths in and out. Again, what do you notice? Is there pressure on any part of your bottom or thighs? Are there different temperatures? Take a moment to describe in your mind what sensations and feelings are occurring on your bottom and the thighs. Let your awareness expand to include the legs of the chair and the floor. Rest in the knowing that the chair and the floor are supporting you. Third, let's focus your attention on the sensations in your back, leaning against the back of the chair. Keep your attention on that area for just a few minutes. Allow yourself to become relaxed, more aware of your back, resting on the back of the chair. Focus on how the chair holds you, how it supports your back, and keeps you from falling down on the floor. Take deep breaths in and out. Again, what do you notice? Is there pressure on certain parts of your back? Are there different temperatures? Describe in your mind what sensations and feelings are occurring in your back. Do you feel stiff, soft, tingling? Let your awareness expand to include how the back connects to the chair, to the legs of the chair, and to the floor. Rest in knowing that the back of the chair, and the legs of the chair are supporting you. Finally, tell yourself you are in one location. Tell yourself, I am located here. I am supported by the chair. I am supported by the floor. This is the place I am located in, this moment. Let's finish this exercise by taking deep breaths in and out. And reflect on ways you feel different than when you started the exercise. To summarize this presentation, information was provided on the impact that trauma and complex trauma has on the brain in the different developmental stages. Resilient factors were also highlighted, in addition to a trauma intervention known as the grounding technique that was described and demonstrated. My hope is that through this presentation and the ones that will follow from my team, that we can continue to aid and equip you with additional knowledge and tools to effectively work with this ministry. Jakujo.